Hello guys, and welcome to this video to learn about the chemical elements and the main biomaterials used in dentistry by looking at the periodic table, okay? So we are going to see clinical cases using all these materials, so please, if it's your first time here watching this channel, don't forget to subscribe, to hit the like button so that we can disseminate this knowledge a little bit better, and to check the previous videos of restorations, the main concepts, the principles of occlusion, because those are very important as well to understand about this video, okay? So without further ado, let's understand that we have mainly three types of biomaterials in dentistry: the metallic ones, the ceramic ones, then the polymeric ones, and we also have the composite ones, which is in many books described as a fourth type of biomaterial. But here in this video, we are going to describe the main biomaterials used and mainly for restorations, okay? Although we are going to cover bone grafts a little bit and other biomaterials nicely used in clinical cases entirely shown to you now. All right, so without further ado, try by yourself first to identify which is this element, and it's an element very well used in dentistry, especially in the old times, okay? So I assume that you guys already know we are talking about gold, right? So that's basically the gold restorations, right? So you can use gold for restorations. Of course, it's expensive, but then we have very good mechanical resistance. Well, depending of the alloy that we use, so we need to use alloys. We are going to describe this very soon in this video. And then we have very good seal between the material and the tooth. And that's one of the best advantages of the gold material. It's also resistant to corrosion because it's a noble metal, of course, right? So just like silver, just like platinum, those are noble metals, which means that they are way better resistant to corrosion in moist environments, for example, the mouth. And that's a very nice advantage of gold. But as you guys know, it's expensive, right? So that's basically the disadvantage of gold. Here in this picture, you guys are seeing a dental implant adjacent to the gold restoration. We are going to show the entire case to you guys actually. And the dental implant is titanium, of course, it's not gold, but we are going to cover titanium very soon in this video. Stay tuned, leave the video open if you are, if you are driving, at least leave the audio open to listen to this lecture. But if you are at your house, just watch the video because it's a very nice video about biomaterials. Even for the exams of biomaterials, it will help for sure in some aspects. All right, so we have to work with alloys, of course, and those are the main alloys, okay? So gold is usually combined with copper and platinum, for example, because these will increase the mechanical resistance of gold, of course, right? So copper and platinum, the ones in purple, the squares. They can mix with a silver as well to compensate the color of the copper, so this helps for some reason. And then zinc can also be added to lower the melting point. And if you lower the melting point, it's easier to fabricate by the laboratories, okay? So depending on the dental laboratory, a different proportion, a different alloy would be used, but basically that's the main alloy described by the books, right? So those are the alloys and the reasons why to use the alloy for gold restorations. So let's see the next one, and the next one, it's the full metal crowns. We are saying metal here, of course that's not an element, but the full metal crowns, the entire crown made of metal, has usually a very specific alloy which can vary in proportions, so different laboratories would use slightly different alloys. But the main components are, take a look at this, noble metals as well, including gold, which could be used as well. So platinum, palladium, and silver. So those are the four dark purple squares that you are seeing on the screen. And of course, those are very nice noble metals for, to make the crown. But then nickel and chromium are also added in minor proportions. And while you have, of course, some resistance to corrosion, it's not like gold. So for long-term use, for example, it can get, just like this case over here that you guys are seeing now, it can get corrosion and oxidation and problems like that, right? So this is actually a problem. But at least it's cheaper, okay? And the corrosion can be better or worse depending on the composition of this alloy, okay? And of course it has a nice mechanical resistance considering the metals that are being used by this alloy. Now take a look at this, how this metal appears on the radiograph. I'm going to show the radiograph of this case. And of course it's radio opaque, as you guys should know, right? Now, if you guys are watching this video, you guys are seeing this picture and you guys are thinking that the second molar has some draining purulent content, some pus here on the distal aspects of the buccal periodontal pocket, then yes, you guys are right, there is an infection on the second molar. Let's understand about this case. So you guys are seeing now the crown of the first molar in the radiograph, okay, so that's a metal crown, it's radio opaque. And more radio opaque than the resin restorations. And the resin restorations, which are composite resins in this case, they are radio opaque. They can be more radio opaque. Nowadays, even the condensable ones are more radio opaque, but always less than metal, right? And others are less radio opaque. So you can have different radio opacity levels of different resin materials, okay? Now, what's happening here? So the first molar has this very old crown, even with overhangs. So, you know, you need to plan a treatment here, but the second molar has a radiolucent lesion, okay? So it's a very well limited radiolucent lesion, could be a radicular cyst or a periapical granuloma, most likely actually. Here, this is an OPG, so you might want to take a periapical radiograph to make sure that there is this furcation involvement. But there is defurcation involvement because we are seeing the draining sinus tracts, right? So the draining periodontal pockets there. Okay, if you extract the second molar, for example, which would be a nice indication, then you could check by the distal side this, crown of the first molar. Maybe you could do something and try to keep this crown, but the crown is very old, so replacing the crown would also be a nice option for the patient, okay? And always check the occlusion, of course. All right, so let's see other materials. Cobalt chrome, one of the most important materials used for frameworks, for copings like this one over here. There is a trade-off between strength and toughness because if they are made with very high temperature by the laboratories, then they lose strength, but they become less brittle, okay, which is nice. So there is a trade-off depending on the casting temperature. Fatigue and tensile strength they have, but poor frictional properties. That's the characteristics of the cobalt chrome alloy. And then they add molybdenum to make more stable, and then nickel as well they can add in minor proportions. So that's basically the alloy used, or the alloys that can be used in dentistry. Okay, so cobalt chrome molybdenum would be the most common one. And let's see this case first. Take a look at this. Now you have the crown, because that was just a coping, and now you have the final porcelain fused to metal crown or metal ceramic crown. That's basically a porcelain which is fused to this coping, and the porcelain contains, for example, feldspar in the composition. We are going to talk about feldspar in this video very soon as well, all right? So you would check the occlusion. The palatal cusps are in occlusion from here, but you would check, of course, in the centric and dynamic excursion, and then you would finalize this case nicely, at least from this point of view of this tooth. Okay, we are not commenting medical history and all the aspects. Then we have amalgam. Okay, so take a look at this. We have now to check, of course, that's a class 2 restoration. So how are the interproximal contacts of this restoration? And you guys would take a nice periapical radiograph or bitewings, and then you guys would check the adaptation and the interproximal contacts of this restoration. So amalgam can be used for class 1 and class 2 restorations mostly, even class 5 sometimes, but those are the main indications. It's resistant, there can be staining. We need to be careful because there is mercury in the composition, and that's of course not healthy. We already know about this. There is no bonding, and that's why you guys need to do a very nice preparation on the tooth to have mechanical adaptation, because there is no bonding from the amalgam on the tooth, and of course it's not static material. So those are important disadvantages or drawbacks of amalgam. That's why several clinics are using less and less. Okay, so now we have the alloy here, which is silver and tin. Okay, so those are the main components, with mercury, which is a small proportion, but again, mercury is not healthy, okay? So we even as a small proportion, it's not good for the patient. And then they can add zinc and copper as well to those alloys for reasons to become stable and to increase a little bit the mechanical resistance to finalize this alloy, and that's basically amalgam. All right, let's see now this case, because we have a cavity there, and then the cavity, instead of amalgam, was filled, was restored with a very nice composite. So that's the composite restoration, and just showing to you guys that you have the option of amalgam. Of course, you removed all the caries, now you have the cavity, and then if endo is not needed, if root canal treatment is not needed, then you would proceed with a nice restoration or a crown if cusps are involved. But here in this case, a restoration was decided, and then this was the treatment plan. So now you are seeing another class 2 restoration of the first premolar of this patient, and then again you would check the adaptation of this restoration and of course of this old resin restoration of the second premolar on the bite wings as well. Very nice. So now we have stainless steel, and of course it is used in dentistry as well, in the orthodontic wires, brackets, and even the old wires to reduce fractures. Now they use the titanium plates, of course, with screws. Even CAD/CAM is being now used with this, so there is digital workflow for MaxFax as well. But the wires can also be used. The thing is that the wires are not so biocompatible, so they are usually used for temporary appliances, okay? So inside the body, they can undergo corrosion, and they are that's why they are not so biocompatible like titanium of the dental implants, okay? But you are just seeing now an orthodontic appliance to help bring in this impacted canine from the palate of the patient. And now there is brackets as well in the buccal aspect of the teeth, we can see a little bit. And of course that's part of an orthodontic treatment to bring the canine in position for this patient. There are also elements in the stainless steel present which are non-metal. So metal, we have manganese, nickel, chromium, and molybdenum, okay, with nickel and chromium being in nice proportions there. And then we have carbon, silicon, phosphorus, and even sulfur in very minor proportions in the composition of stainless steel, all right? So look how nice, how interesting. Then we have titanium, which is lighter. It's a light material, it's biocompatible, it's resistant, okay? And usually we have the titanium elements there, but there are very important alloys. One of the most important is with aluminium and vanadium, all right? So this is basically the most important alloy. Maybe iron, carbon, nitrogen, and oxygen in very minor proportions can be there as well. But titanium, aluminium, and vanadium are the three main components of one of the main alloys described by the books. Okay, and look how nice. Not only for dental implants, but also for the implant components like the platform, the healing abutments, the prosthetic abutments. Okay, so and they can now be milled as well. So they can be milled with CAD/CAM. Well, even the implants are milled. But the implants can now also be 3D printed, okay? So 3D printing of metal, that's amazing. This is also something very nice that's happening now. Well, let's see this case first, of course. And then we have a bone graft material because we have this buccal descent. So the flap was open, and then you are seeing the implant because of a buccal bone defect, of course. Due to a previous fistula, this was actually the case. And now filling the defects with the graft material. So here I used bone ceramic from Straumann. That's calcium phosphate, okay, so that's biphasic calcium phosphate. Steel elements of the periodic table, of course, and even hydroxyapatite, okay, which is composed by calcium, phosphate, and hydrogen. Those biomaterials, they are osteoinductive. They will allow for the bone to heal there. And hydroxyapatite is non-resorbable, but will also help maintain the structure. So very nice biomaterials. They are not classified here, of course, as metallic materials, but they are classified as ceramic materials. You know, those are resorbable ceramics That's why the product that I used is actually called Bone Ceramics by Straumann. But let's see the case. So now the area of the fistula was open, and then I just sutured in the middle because there was a fistula, of course, so the soft tissue defect as well. And then the implant is down there. So even the platform of the implant was down there. We still have some space until the adjacent molar, which is the tooth with the gold restoration. Of course, I know that you guys realize that. But the buccal defect is now overcome. So now the buccal defect is now filled and nicely, corrected. Now you can, of course, do the impression of this implant or of the implant abutment using this piece, which is implant transfer abutments. Take a look at the mesial papilla. The mesial papilla is there at least. And of course, the molar has furcation exposure and all this very bad condition, right? If you guys go back in the video, you guys will see the conditions with the flap open of this molar. But okay, so now we are rehabilitating the premolar first, and then the impression is performed with an open tray here, and then you send this to the laboratory. You could even try the coping, for example, but now you have the final metal ceramic restoration. A very nice porcelain fused to metal restoration, and then this tooth site, of course, is now rehabilitated. How the titanium looks like in the radiograph, and of course it's radio opaque, right? So that's a CBCT scan taken for other reasons, of course, but for further steps of the treatments. But then we are seeing the buccal site in the left of this radiograph, of this image, which is a CBCT, and the palatal site in the right side of this image, because that's a cross-sectional slice of a CBCT. The implant looks like being within the sinus limits, but the implant is not perforating the sinus membrane, as you guys can see. We can see the limits of the sinus membrane on top of the implant because the membrane was nicely elevated, okay, using Summers technique. So just a nice sinus floor augmentation using osteotomes. And then the implant is placed there without grafts, but not perforating the membrane, okay? So that's basically what I did in this case. And now you have the platform, and then even though the platform is there, a different abutment was used, and that's why the crown is adapted to these different abutments, not to the platform itself. Okay, so that's how the case was finalized. All right, now we have the ceramic materials. So now we start a different family of materials, which is very important for a lot of restorations. So let's check them now. First one, zirconia. And zirconia means the dioxide of zirconium, right? So this is ZrO2, and then yttria, which is basically Y2O3, so from the element yttrium, is also added usually to get more translucence and even to stabilize the alloy, okay? So we have now the tetragonal crystals of zirconia called YTZP, all right? And that's basically a very nice alloy, so a very nice material of zirconia that is used in several restorations, crowns, fixed bridges, okay? And then, of course, zirconia, the opaque zirconia, which is not this one, of course, it's a different composition. It's so much more opaque, okay, without the yttria, and this can be used for frameworks as well, and even for porcelain fused to zirconia crowns, all right? Then even implants of zirconia can now be made, so that's actually very interesting as well. And it's the material for restorations with the highest flexural strength. If you guys don't know the difference between the ceramic materials, go back to my video of ceramic materials. I will add the link here on the top right corner of this screen. It will show up at some point in the video. And you guys will know all the difference of flexural strength indications and all the differences among all the ceramic materials used in dentistry. Okay, so that's a very nice video as well. That's why we're not going to explain all these differences here. There is already the other video. All right. Now we need to understand about other materials as well. I am actually writing here IMEX because it's a nice brand known, but well, of course we're talking about lithium disilicate, right? So we have lithium disilicate, and then that's basically glass ceramics, right? So there is a way of doing these materials with crystals of glass. the glass ceramics, and then you have very nice aesthetics, very nice translucence, and still a good flexural strength, a little bit less than zirconia, of course. Even zirconia with layering have higher flexural strength than IMEX, but it's still a nice flexural strength, okay? Go back to the videos of ceramic to see all these values, it's very interesting. All right, now the chemical formula is, of course, with lithium, with silicon, and with oxygen. That's the chemical formula, making this very nice ceramic material. What ceramic means? Ceramic material is a material that has the main components of this material being inorganic, so not a metal, okay? That's why zirconia is now classified as ceramic as well, and not as a metal, because we have the dioxide of zirconia, so zirconia here is a ceramic material, not the metal that we have in the periodic table, of course, okay? Not only, it's actually a combination of elements. All right, then we have feldspar, which can be used for anterior all ceramic crowns, or of course it's part of the composition of porcelain fused to metal and porcelain fused to zirconia crowns. Very good translucency, amazing translucency, but not so strong. And of course you wouldn't use feldspar for posterior restorations, right? That's the thing, but they have amazing translucency. Some patients require, they have high smile line and very translucent teeth. You need to achieve higher translucence than usual, and maybe you can consider this as an option. So for feldspar, we have all these elements being aluminum, silicon, and of course oxygen, one of the three main components of the chemical composition. But then we have the X, which can be sodium, calcium, or even potassium in minor percentages, of course. All right, then we have the polymeric materials, and then we have a lot of materials, but take a look at this. The main one that we are going to comment here is the PMMA, okay, polymethyl methacrylate. And then we have the temporary restorations, although they are now developing very nicely, and they can be used as long-term temporary restorations because there are modified PMMA materials. They can be also used for surgical guides, bite splints, okay, and that's basically the formula. So carbon, oxygen, and hydrogen being the main components, of course, of the periodic table. But don't forget that instead of PMMA, we can 3D print light curing resins that are composed by monomers and oligomers instead of polymers, okay, and you will still have very nice results. So you still have restorations, surgical guides from the nice resins, 3D printed resins, even bite splints. And then there are now hybrid materials, so the resins with ceramic particles, okay, even with zirconia particles, and those would be hybrid materials, okay. So that's why if you guys are watching this video and this is a year in the future, then don't forget to make sure about the current technology, because you might have other options here as well. Okay, just to show to you guys that the PMMA can look the nice margins of these crowns, the nice finish lines, and to show to you guys that it's actually a nice material that can be used nowadays for cheaper options. That's relevant even for public health. So we have a chapter in our book of digital dentistry published by Wiley Blackwell, of course you guys know that, only describing those advantages of these materials as well. Okay, so you mill and it's basically ready. You could polish, but it's basically ready to be used, to be installed in the patient. Okay, so that's a very nice material. All right, so I hope you guys liked. Don't forget to check the other videos of Principles of Occlusion. Okay, follow up this channel. This channel is made to disseminate knowledge, to make us a very nice group of dentists, you know, disseminating knowledge to benefit our patients. Don't forget to subscribe, hit the like button if you liked, and see you guys in the next videos.